and it is time for our once in every second week to talk about COVID-19. We are very excited today to have a special guest, Dr. Hudson Garrett, with us. We will introduce him in a minute. Before we do that, please make sure that you type in the county that you come from into the chat so that we can track our spread and how we are able to get the message out. And also, before we continue, we are going to ask our medical director to give us an update on how things are in Kentucky in relation to COVID-19. Dr. Furman, the floor is yours.
Welcome, everybody, and happy December. I can't believe it's December already. I've got my holiday sweater on, trying to get into the season. So I tell you, I think we have the best present ever is that we have vaccines coming. And I got a call yesterday from the chief medical officer at UofL Health. And UofL is getting a shipment next week of 1,000 vaccines, and UofL Health will keep getting 1,000 a week. In the state of Kentucky, Pfizer is getting delivered on Sunday or sometime next week, 38,000. I think of those 38,000, that's where UofL Health is getting 1,000. The week of December 20th, Moderna is shipping us 76,000 to the state of Kentucky. And the week of December 27th, 33,000. Now those numbers could change up or down, you know, depending. But I will say, I think it's so sad that like 66% of the deaths are in nursing homes. But I think it has made people aware that older people exist and we have to do a lot to take care of them. And that's what the Optimal Aging Institute and the Traeger Institute, the Optimal Aging Clinic and the Traeger Institute is all about. So UofL Health is going to have the geriatricians vaccinated, one of the first tiers, which is amazing because I don't think people knew geriatrics existed a few years ago. So the nursing home population is going to be prioritized. So the state has a whole model of how they're going to release those vaccines. But when you get the vaccine, then you have to get a booster 3 weeks later. So this will all happen, you know, start happening next week. And then yesterday, the governor's announcement in Kentucky yesterday, there were 1,972 new cases. There were 10 deaths yesterday. The positivity rate is 9.6%. The total deaths from the beginning of this pandemic in Kentucky is 2,082. Currently on the ventilator is 210. And the governor gave some examples of people, you know, some stories of people who died. And one was a custodian at Westport Middle School, I'm pretty sure, and, you know, got it from school. So, you know, the big take home point is stay home if you're sick. And people say, oh, it's just a cold or it's just my allergies. Well, sometimes those cold and allergies are the COVID. And so any symptoms, stay home, talk to your doctor, and then decide if you should go to work or not. The governor also had a remembrance ceremony yesterday because it was over 2,000 people that died. I think he did that when 1,000 died also, and hung a wreath in the state capitol. And so we just want to remember to do our best. And the governor just remind everybody what the guidelines that are in place now. No in-person school, no in-person restaurants or bars. Private events at homes are limited to 8 people with no more than 2 households. We have moved a lot of our patients to telehealth, and so we're trying to encourage telehealth. If people need to come in and be seen, it's totally fine. We can see people in the office, but we're encouraging people to decrease. There's so much community spread. We just want to decrease exposure. We are, you know, the restaurants and bars are no indoor food or beverage consumption. Carry out and delivery are encouraged, and socially distanced outdoor seating is allowed. The gyms, fitness centers, pools, and other indoor recreation facilities are at 33% capacity, maintained at 6 feet apart, no group classes, team practices, or competitions, and masks must be worn while exercising. And that does not include college or professional athletics. For venues, event spaces, and theaters, each room will be limited to 25 people. This applies to indoor weddings and funerals. And professional services, you know, which is our offices, office-based businesses are limited to 33% of employees. All employees who are able to work from home must do so. All businesses that can close to the public must do so. And so these are in effect through Sunday, December 13th, and then we'll see what the governor says after that. So that's my update. I'm available for questions, but really, we have such a great speaker. I think he'll answer all the questions. He's taught us so much for part of our Project Echo. So we really appreciate you being here. So now, Dr. Fall, is there?
Yes, thank you. Thank you, Dr. Furman. I am really now honored to tell you a little bit more about Dr. Hudson Garrett. He's going to talk to us about COVID-19 infection control during the holidays. And he's like a jewel that we found. You know, he just suddenly appeared at the Traeger Institute doing these amazing nursing home sessions for it's over 200 nursing homes that we work with. And Dr. Hudson Garrett joined our team in working with the nursing homes to help them with infection control. So we're really just excited to have him here. We wanted him to talk to everyone a little bit about his knowledge. And just to give you a short summary he's got a very, very long bio. I'm just going to put some highlights out there for you. So Dr. Hudson Garrett is a faculty appointment as an adjunct assistant professor of medicine in the Division of Infectious Diseases at the University of Louisville School of Medicine. He has also co-founded the nonprofit Infection Prevention Institute to help shepherd dissemination of best practices of infection prevention and control across the healthcare continuum of care globally. He holds a graduate certificate in infection prevention and infection control from the University of South Florida. He has completed the Johns Hopkins Fellows Program in Hospital Epidemiology and Infection Control. He's also a fellow in the Academy of National Associations of Directors of Nursing Administration, the American Academy of Project Management, and a senior fellow of the Management and Strategy Institute. In 2019, he was inducted as a distinguished fellow and practitioner in the National Academies of Practices. That's just a short little intro of many, many more to come in his bio. But I don't want to use all the time to talk about all his accolades. I want him to tell us a little bit more about what we should do over the break to keep ourselves safe. And I just want to say thank you, Dr. Garrett, for spending time with us. We really appreciate your knowledge and the way that you share that with everyone. Thank you.
Well, good morning, and thank you, Dr. Paul and Dr. Furman, for the warm introductions. It's absolutely a pleasure to be here with you during my favorite time of year, which is Christmas. I start my Christmas season with my honey baked ham on Thanksgiving, and I finish it with a second honey baked ham just for quality assurance purposes at Christmas time. So I'd love to spend the next, few minutes that we have together to talk about some of the things that I think we need to be aware of, and specifically what we can do to keep ourselves and our families safe. And I want to start with a little bit of a personal message that I understand that there are many, many restrictions that exist where you live and where many of us live. For example, I'm based out of Atlanta, and I've treated about 2,500 COVID patients so far. And it's something that every single time you see a COVID patient, you think that you've seen it all, and yet you have not. And every single patient is different, just like every one of us is different. That being said, I want to encourage us to try to take safe practices to enjoy our holiday season. Many of us have been cooped up for many months at a time. And so I think it's so psychologically healthy to take the practices seriously, but also to be able to be around friends and loved ones in sort of a safe manner. So I wanted to sort of go through a couple things that I think are really key for us to start with, which is sort of where we are today. And where we will most likely go and how we can sort of keep ourselves safe. And if you do have any questions or there's something that doesn't make sense, I would encourage you to type that on the chat box. Justin has promised to interrupt me, and we will go ahead and address those questions as I go. But I wanted to sort of first address the elephant in the room, which is the increase in cases that we're seeing both in the state of Kentucky as well as nationwide. And people are calling me all the time and they said, well, Hudson, what do I do? There's so many cases. There's so many cases. Should I be worried? And cases alone are not what make me jump. And they're not what keep me up at night. What makes me very, very concerned is when I see sort of a cascade of events that takes place. For example, if we see a lot of new cases, we see a lot of hospitalizations, we see a lot of hospital resources that are not available, and we see an increase in that death rate, those are things that keep me up at night. And so as you look at your local county data, your city data, even if you go out of state for the holidays, really, really, really dig into the CDC's website and figure out exactly where you're going. So you would have an idea of sort of the geography that you're going to be in and specifically what's going on in that area. Some areas are not having many problems while others are having massive problems. And so sort of understand the nuances of that. That being said, I always think about the road trip concept. So I'm just going to use myself when I go to the beach every May for my birthday. And as much as I would like to, I can never make it the 6 hours without having to go to the bathroom at least 2 to 3 times, right? And so when you are traveling this holiday season, think about not only your final destination, but where you may have to stop along the way for food, for gas, if you're going to have to go into a convenience store, go into Target, whatever it may be. And there's some basic precautions we'll talk about. So again, I'm really looking at cases, hospitalizations, available resources, et cetera. Now, let's talk for a second about what we should do before we interact with our loved ones. I have not actually seen my own family in person but once this year, which is very, very unlike me. I usually see them at least once a quarter. They're about 4 hours away. But my parents are of the age that they're in that high-risk group. They also have some health conditions. I've also got a newborn baby in the family. My sister-in-law, who actually had COVID, is a nursing home administrator. And so we've got a lot of different scenarios within our family and a lot of older people that are going to be in that vulnerable population. And I love Dr. Furman's introduction about sort of the role of that geriatric population and those geriatric specialists, because I would agree it's, I almost feel the same way she does that, not only did geriatrics become alive with COVID, but so did infectious disease. And everybody was like, well, there's actually people that do this for a living. And so, normally people run away from us. And so it's great to see that they're now trying to understand the expertise that, folks like Dr. Furman and the team are bringing to that geriatric population to care for them. It is a specialty that requires a special approach. And when you think about going home, there's a couple things we should think about. Number one is, are you symptomatic or have you been around anyone who might be potentially exposed? And this is a big one. If you go into a store that's being very aggressive with screening, for example, they may check your temperature. They may even ask you, have you had any symptoms? But that's really not comprehensive enough. What we also want to know is, have you traveled outside of your home area? And also, have you been exposed in the last 14 days to someone that either was suspected or confirmed had COVID-19 infection? Right. And so these are important elements. And, for my own family, just to sort of make fun of myself, I sent an email and I said, if I'm coming home for Christmas, here are the conditions that are going to happen. Because, I wanted to understand where everyone had been, what practices they had followed, where, for example, I identified that my brother had been a little bit naughty over the last 2 weeks about wearing his mask. And he admitted it. And so I said, well, that's good, because now you have 14 more days to get yourself together before I come and see you. And so it's really all about those open, transparent communications. The second thing is to think about that concept that you may have heard about in the CDC documentation, which is called universal source control. And all this means is that if I wear a mask and you wear a mask or face covering, that our risk of transmission to each other is greatly reduced. And so when we're not able to socially distance and we're not able to be outside, which right now it's 33 degrees outside, so most people are not going to do that, that universal source control is extremely helpful. Now that sort of leads to another question, which is, what type of mask or face covering should I wear? And there's a wide variety of solutions out there. It's interesting, when this all hit, there were no masks, there was no hand sanitizer. It was hard to even get a bottle of Clorox. And now you can find masks at every grocery store. You can find them at every gas station. It's amazing the places that you can see them. I actually saw a mask dispensing machine the other day in the hospital, which I thought was just bizarre, being in a hospital. So, any type of mask is going to be more helpful than not. So if you have a face covering that you're using, that's good. Certainly, if you can use a medical grade mask, that's going to be even better. And I do have folks that are at very high risk, like oncology patients, those that have compromised immune systems, that do elect to wear some type of respirator. And that's okay too, if you're at that very high risk based on your immune system. So any of those things is going to be helpful. But the key here is to wear a mask when you're around other people, right? Now, let me tell you where this doesn't apply. And I see this all the time. Just actually this morning when I went to get breakfast, I looked over to my left and I looked to my right, and both cars had one single occupant, one person in the car, and they were both wearing masks, right? There's no need for that. And so this is unfortunately where that sort of misinformation comes in, that if you're alone and you're driving in your own personal vehicle, there's no need for you to have to mask. This is not the spread airborne wise that we think about with tuberculosis or measles or some of the much more communicable diseases. And so I just wanted to sort of point that out. The next thing is really about social distancing. And this one is challenging because I have a terrible depth perception about figuring out where 6 feet is. I will also tell you, and I think Dr. Furman will agree with this, when you do go into healthcare facilities, we forget about social distancing quite often, right? Because we're all masked. And so I'm constantly having to tell people in nurses stations and even physicians that are doing dictations with 8 people in a little area, let's spread out. Let's try to not sit right next to each other, even though we're all wearing a mask. The other thing is, let's not send 10 people into one room. So if you're going to have a great buffet, I totally encourage it. Have the more honey baked ham you can have, the better. But let's not crowd the entire family in that room at one single time. One of the best allies we have with this virus, as well as other respiratory viruses like flu, is fresh air. Fresh air and sunlight are great things to have in our arsenal. So if you have the capability of sitting outside, if you have a covered patio or an outdoor heater or one of those fireplace pits, these are the great times to break that out and enjoy those family moments. But we want to ensure that we really don't place too many people in the same room together. Now, there's another sort of thing that we can do, which is going to make you sort of laugh, which is exercise good common sense. I know growing up as a child, my mother used to say, Hudson, you do not have any common sense. And she said it was when I was 22 years old and I graduated college that somehow a light bulb went off. And so I feel very blessed that that light bulb finally went off. But, sometimes it's really just about critically thinking through a situation. For example, do I really need to go into that crowded restaurant to pick up my meal? Or is there a possibility that they can do curbside delivery, right? These are just common areas that we can exercise good judgment. Another one is, do I need to go to the gym, or can I do my workouts at home? Now I will say some gyms where I live have done an exceptional job of trying to make this work. They have appointments where you can come in and work out. Everybody's spaced out way more than 6 feet. The gym that I'm a member of actually has deployed portable Hepa filtration throughout the gym, which was way more than they were required to do. And I actually feel fairly safe. I will say this, though, it is pretty much impossible to work out in a mask very comfortably, right? And you have to basically, expect that mask is no longer valid. So, that's one of the things with masks that I would like to mention is if you go outside and it gets wet, you perspire because you're exercising. Anytime that membrane is broken down, that mask is no longer viable to use. And so if you get surgical masks, for example, which many of us have, ensure that you throw them away regularly. These are not items that are designed to be reprocessed. We are doing some level of reprocessing for respirators in hospitals, but it's not something that we'd want to do in the community setting. It looks like we have a couple of questions that have come in. So the first question is, if you've been exposed to COVID by someone who tested positive when you were in their presence masked, is it okay to just get a test to make sure you're negative, or should you still quarantine for a time? If so, how long? So it really depends on if both parties were actually masked. So if both parties were masked and you were more than 6 feet away, there's really very minuscule risk. So it also depends upon what you do for a living. So for example, if you're a healthcare provider, a police officer, a firefighter, in some cases a school teacher, you may not have the ability to quarantine. If you think about, and I'll just use the police department here where I live, they had one officer that was exposed and they were going to quarantine the entire shift. That was 15 officers that would no longer be on the streets. Well, they don't have any reserve officers. I live in a fairly small city outside of Atlanta. And so it would have been catastrophic. So there are certain essential workers that are, necessary to come to work. So if both parties are masked, it's pretty safe. I'm never, ever going to discourage someone from getting a test. But keep in mind that that test is a 1-point snapshot in time that tells you today at 10:20 a.m. I was negative. And I will tell you, I have seen patients personally that tested negative in the morning and tested positive later in the evening. It also depends upon what type of test you use and frankly, who is collecting the test. If you collect the test incorrectly, there's what I call the brain scraper test, which is that nasopharyngeal swab that we're all terrified of, that goes way back, it feels like, into your brain. Those are difficult to get right. And so people need to be properly trained in order to collect those specimens. We're seeing now tests like Saliva Test, tests that we can do in just the oral mucosa. So it really depends. Not every test is as accurate as others. And so especially if you're symptomatic or your family member symptomatic, don't take the negative test as the word, right? Make sure that you consider that, just as Dr. Furman said, if you have symptoms, right, consider it COVID until you prove otherwise. And for me, I always recommend 2 negative tests at least 24 hours apart in order to rule that out. I have terrible allergies. So it is not unusual at all. And I usually have a sinusitis infection, I don't want to curse myself, right around this time. And I know that, but I will tell you, I'm also going to get tested for COVID when that time comes, just because of the community circulation that's taking place. But if there is a high risk exposure, one person is not wearing a mask or both parties are not wearing a mask, CDC has recently changed their guidance on this. So you can either quarantine for 7 days and be tested negative, or you can stay in quarantine for 10 days if you decide not to be tested, or frankly, you can't get tested. It really just depends on what your preference is. Not everybody can get a test. Certainly a rapid test is always much more advantageous for us because we get a little bit more of that immediate satisfaction. Like most men, I have to have an answer right now. I'm very impatient. And so I want to know what that result is, but that's not always possible. And a good place to always start to look for testing resources is your local health department. So contact the county health department. You can also go on websites like cvs.com that have some of those national footprints of resources as well. So hopefully that answers that question. Another question that came in from Teresa, thank you for posting this, is I'm seeing with coworkers who are exposed, they're getting tested, it is negative, then they're starting to have symptoms and test again and it's positive. Should we delay testing to prevent having to get tested more than once? So that's a great question. So, as I said before, and as Dr. Furman said, if you are symptomatic, I don't care what your test says. I want you to resolve your symptoms before you return to work. That's just out of an abundance of caution right now because of the widespread community circulation that many of us are seeing. So, in one single test, if I'm an employer, is not going to be adequate for me. I'm going to want to see 2 tests apart and resolution of those symptoms. Now, normally, for example, if you have allergies, you don't get a fever. So, there's little nuances that might differentiate between allergies, the common cold, influenza, which of course we're going to have circulating, or COVID. The challenge that we're facing right now is that many of the symptoms are similar. So that means that we may have to do more testing than we would normally do in order to rule out some of those instances. So if a coworker is testing negative and then positive, it's very likely that either the incubation period was not fully sort of, baked out, if you will. We don't want you to be tested 24 hours after exposure, for example. Normally, we want to see testing between 3 and 5 days, up to 7 days after that exposure to really look for that potential conversion that might take place where we would see it in the test. But again, if you're symptomatic, stay home from work. Now, this sort of brings up an interesting point, Teresa, because what about the employer's responsibility in this? And if you look at many of us, and I think up to 2/3 of the US population lives paycheck to paycheck. So not having that steady resource of income is hugely problematic, right? That's sort of an operational issue for your own household. And so I would really encourage those of us that are either managers or supervisors or work for an employer to have those proactive conversations with human resources to say that, we want to have a good policy in place now so that we can actually encourage colleagues to stay home if they're sick, and hopefully we can pay them. We've seen this done in certain industries like public safety and in some hospitals. Sometimes it's a workers' comp issue. It really just depends on the circumstances. But what we don't want to do is make it easy for people to do the wrong thing. We want to make it hard for them to do that. And so sort of that ability to isolate and compensate those people is really, really helpful. Another question came in from Justin. Do HEPA filters need to be periodically changed or sanitized? And then also, what do you think of the home oral test? I'm not sure they're on the market yet. So if you're using a HEPA filtration system, the first question I would have is where and why? In your home environment, there's really no reason that you need that. Unless you were to have a very high risk individual, like an elderly loved one that's living with you, maybe receiving chemotherapy would be one of the things that comes to mind. But we don't normally recommend HEPA filtration unless there's a specific need. Even if you look at the CDC's guidance for buildings, the biggest thing that they talk about is increasing the fresh air. It makes total sense. Right? If you can, obviously isolate people in certain areas so that they're not all congregated together. But fresh air and sunlight are your best possible allies that you have here. So you really don't need to spend the money on HEPA filtration unless there's a specific need. Now, for example, even in hospitals, just to give you some perspective, we don't use HEPA filtration all over the hospital. Normally, we use HEPA filtration in high-risk areas like a bone marrow transplant unit or an oncology treatment area, where there's very, very vulnerable populations of patients that if they were to get a cold, it could unfortunately take their life. And so what I would suggest is, good air filtration. Make sure your HVAC system is serviced. That's a big thing right now, especially as we move into winter. Increase your airflow that's coming in, and there's ways to do that, especially in commercial buildings. But you really don't need to worry about HEPA filtration. Now, if you are using the HEPA filtration, there are always manufacturer requirements. They are normally, in the newer machines, it will actually tell you when to change the filter. So it will detect the presence of some of that soil there, and it will tell you that you need to change that. That can be anywhere from 3 to 6 months in my experience. It really just depends on how often you're running it and what the particulates are that are being collected there. Looks like the second part of the question is, what do I think about the take-home test? So I think it's fantastic that we are getting so many different types of tests out there. What has taken place since, really February is phenomenal, in my opinion. The fact that, as Dr. Furman mentioned, we're now getting vaccines, and she was able to give you direct numbers as to how many vaccines the state of Kentucky was getting is purely exciting to me. The fact that we have multiple different types of rapid diagnostics and tests that aid us in looking quickly at sort of screening, is this COVID, is this not, is fantastic. That being said, every single thing has a pro and a con, right? So some of the take-home tests are not as sensitive as the ones that we might use, for example, the brain scraper test, where we're actually doing that PCR test in the back of your nose. And so, anytime you see a positive result with any of these rapid tests, we would always recommend that you confirm that with a more specific PCR test. And so those are available through places like your health department, most likely, CVS, and some of the other national chains. So, it's not to in any way say that the take-home tests are not good. They are, but we also want to look at our symptoms and recognize that just because we have a negative doesn't mean it's truly negative. And in some cases, we have tests that have false positives. But if you look at CDC's data, about 50% of people that are spreading this don't have any symptoms. And so that's something that is a big red alarm. And that's very different than things like flu, where we see that seasonal circulation of it. Normally with flu patients, we see a lot more symptomatic people. Folks are presenting sick. They've got that fever. They've got that body ache. They look sick, right? And so that's one of the things that we've got to think about. So another question came in from Ann. Some medical facilities do not retest as part of the procedures if you test negative. They say that if you have symptoms, assume you're positive and quarantine. This happened to my husband after it was determined I was COVID positive. Your thoughts on this? He obviously quarantined as he was ill and also works in a hospital. So certainly, if you have symptoms, you don't have to test. You could certainly just go ahead and quarantine up to the 10 days or until your symptoms resolve. And so that's a really good point that you bring up, Anne, because everybody presents differently. I have seen someone who was fairly healthy that had COVID-like symptoms for 3 months. I have also seen someone who was not healthy that recovered in 14 days. So I wish I could wave the crystal ball and figure out what was really the cause of both of those, but every patient reacts differently. And so I think that's one of the things that we have to think about is not everybody's going to look and feel the same way, which makes it a very individualized attack with this particular virus. So, certainly there's not a need necessarily to retest as long as you're quarantining. So there's just something to think about. Next question is, if you're in a facility with a patient or coworker tested positive and you were not close, should you be concerned that COVID was distributed through the HVAC system? So excellent question, Joe. So about 4 weeks ago, many of you may recall that CDC put out this, let's just call it rather alarming document that said COVID-19 was spread via airborne routes. Right. And as you can imagine, the news media took off with that, and it was all over the news. And people were saying, well, I have to wear a respirator. I need to wear a face shield. I can't go outside. And so it caused this mass confusion. So let me sort of break this down into simplicity that I think hopefully will make very good sense. So there are certain bacteria and viruses that are spread, what we call contact, right? Things that we touch with our hands. Those are pretty easy to stop. We can wash our hands. We might have to wear a gown in a healthcare setting, but we can wash those away from our body. Then there's things like influenza that are fairly large droplets, right? And these droplets can sort of be, expelled from the body through respiratory secretions. So we cough, we sneeze, whatever it may be, and they normally fall to the ground pretty quickly, right? So when you think about taking care of a flu patient, or if you are ever in the situation where you have to take care of a loved one with the flu, a regular surgical mask, a regular procedural mask is completely fine because the particles are large enough not to penetrate through, right? Well, that was what initially was thought as sort of the main route of transmission for COVID. But then there's this third route, which we normally associate with tuberculosis and measles, which is airborne. And airborne particles are very small and they can travel for long distances in the air. There's also this concept of aerosols. I'm looking at the women on the call with wonderful hair. You may have used hairspray today, right? So you may have had some type of artificial aerosol that sprayed that chemical, that solution onto your hair. The same can be true in office buildings, in schools, and daycares, and gyms, and healthcare facilities, where there is that potential for aerosol transmission, where we've sort of got this wet moisture in the air that's sort of like a jet stream. And it can carry the COVID-19 organism for a longer distance of time and stay in the air for a longer distance of time. This is most prevalent in places where we have terrible air circulation, right? So again, the key here is as much fresh air as possible. Good HVAC systems that are constantly going is helpful. And that's really going to reduce that risk. So it's not necessarily that I'm worried about the HVAC system as much as I am about who comes in the building and sort of what they're doing. It is very, very, very unlikely that someone who has no symptoms and is wearing a mask is ever going to contaminate an HVAC system. So if you're doing good universal source control, all the folks are wearing a mask, no one is symptomatic, you're not going to find that as a risk. Where we will have a risk is when we let people sort of through the front gates that are, very symptomatic and have these symptoms, and they're coughing up a storm, they're sneezing, and they're not wearing a mask. There's also been some data for certain activities like singing, which, God forbid I ever sing because the Lord would be very upset with me. But, people that do enjoy those activities do need to be a little bit more careful. One of my own family friends is a pastor, and he got COVID, and so did 15 people in his choir. And so it can be very easily spread in indoor settings where you have certain activities where you're exerting your voice and you're putting out extra respiratory secretions, right? And so one of the things that they do now, which I think is fantastic, is they compromised. And so they actually sing outside. And so they're still able to have their church service. They're still able to have that communal relationship with their loved ones and their friends, especially at this time of year, but they're spread out 10 feet and they have done it in a parking lot and they've had zero issues since. So it really goes back to, again, that common sense exercising. But again, I would not in any way worry about generalized transmission with an HVAC system unless you've got folks in there that shouldn't be in there in the first place. So hopefully that helps answers that question. So I want to, in case there's other questions, we'll take those here as we go, but I want to sort of focus now on what do I need to do to stay safe and how can I keep my loved ones safe? And I'm going to give some basic tips that hopefully will sort of pave the way to a safe, Christmas experience, Hanukkah, whatever you may celebrate with your family and loved ones. The first should be of zero surprise. Wash your hands, right? These are the 10 deadly weapons of our bodies, right? These 10 fingers that we have are our routes of transmission for about 80% of infections that we see. And so if we really have the ability to sanitize our hands, we're going to knock down a lot of that potential transmission. So that may lead you to another question, which is, what do I wash my hands with? Right? You don't always have a sink. Some of you have purses, but you may not have a sink in there. Even though you may be prepared for everything else in your life, it's impossible to carry that. But what you can do is carry an alcohol-based hand sanitizer. And if you have noticed, if you've gone to your local stores, never in a million years did I think that we would ever have a toilet paper crisis. We would have a Purell crisis. We would have a Clorox crisis. And yet here we are. I actually had someone in the hospital the other day actually offer to give me $100 for my Clorox wipes. And I thought I could be a rich man, right? Because, this is sort of that scenario where it's resource allocation. But the good news is that, especially with hand sanitizer and some of the other products, there is a good availability now of these types of solutions. One thing I will caution you on is please, 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 when you buy something that's a hand sanitizer, especially, try to buy it from a reputable store like a Target or a Walmart or a Costco or somewhere that is a more of a national chain, or it's a national brand. So like, for example, if it's a Purell or a Germex or something like that. And the reason that I say that is not to recommend those products per se, but there's the FDA, which regulates hand sanitizers, has found about 75 different brands that are out there that have actually caused poisoning through the skin, or some type of dermal burns to the skin. And so these are some of those sort of, fly-by-night organizations that popped up when COVID hit that said, oh, we'll make hand sanitizer. And so it's really important to make sure you're using something that's commercially ready. And those are alcohol-based. And the great news is alcohol is extremely effective against coronavirus. It's also extremely effective against influenza virus. So if we just wash our hands alone, we're going to be in a very good position. The second thing is to disinfect things that you touch on a routine basis. So I go back to the example in my house of I clean and I disinfect. I clean my home, but I disinfect my toilet and I disinfect my kitchen. And you may say, well, why do you do that? Well, because the risk of something that's harmful to me is more prevalent in the kitchen by far, because if you're cooking raw meats or something like that, as well as for obvious reasons in the toilet area. But the rest of my house, I clean. I don't spray disinfectant. I also don't use an antibacterial soap anywhere other than my kitchen and my bathroom. So in my, other places, I don't necessarily use that. You don't really need that. Good soap and water and friction is going to remove a lot of the potentially harmful organisms. But a disinfectant is going to be helpful. So things like the TV remote that people touch all the time, phones are another example, countertops, places where folks are going to congregate, and you can use any of the regular disinfectants that you can find. There is a list available from the EPA, which regulates these types of products that are effective against coronaviruses. It's called List N. But I will tell you, almost everything that you're going to buy in a consumer setting is going to be effective. There's hundreds of products on that list. So for example, the Lysols, the Cloroxes, the Purells, many of the name brands have tested for efficacy and are deemed effective. So the other thing you can do if you ever want to have sort of a pandemic preparedness plan is to buy a couple gallons of bleach in a squirt bottle, right? You can make your own 1 to 10 dilution of bleach, and it's good for 24 hours. This is something that we have been doing in healthcare because we can't get, our normal wipes and other types of things, but you can make your own solution. And I will tell you, I lived off 1 jug of bleach for over a month. And so there are ways to do that. So hopefully that helps with that thing. And another thing I'd like to mention too, and I'm sure Dr. Furman will chime in on this too, is it is more important than ever to get a flu shot. You need to get a flu shot this year. The concurrent circulation, that sort of, general circulation of influenza as well as COVID, is problematic. What we don't want to do is see a person get both. I've seen it. It's not pretty. It is not pretty at all, and it's especially not pretty in patients that have chronic health conditions like high blood pressure or diabetes. And so I always am pushing for this. And I will tell you, I have some of my best friends are completely anti-vaccine. And it's a very big struggle for me because I'm a major supporter of vaccines that have demonstrated safety and efficacy and help us reduce the risk of disease. We would still have polio without vaccines. We would still have hepatitis B rampant without vaccines. Certainly the influenza vaccine is not 100% foolproof, but it is a step in reducing the severity of disease. Many of you may have questions about the COVID-19 vaccines that are coming out. I've reviewed much of that data. I feel very confident about it. A lot of folks in the public are assuming that the safety data was not generated as it would normally. And that's not true. It was generated. This has just been an expeditious process, unlike anything we've ever seen, which in my opinion is pretty exciting. And so I have no qualms about getting a COVID vaccine. Now, do I expect that my arm's not going to probably be sore and I might not feel well for a day? Of course, I expect that. But that is the natural immune reaction to the vaccine that says it's working. And so that's something that we do have to toughen up a little bit about. I know every time I go get a tetanus shot, like many of you, you may say, oh my God, my arm hurts, and your arm hurts for days. It's not expected to be to that level, but we expect that with certain vaccines that they're going to be a little bit more painful. But I will say this, having seen COVID patients, it is more painful to watch a patient die without their family member present. It's more painful to watch a family member say, I wish I could have, or I wish I had worn that mask, which is what we're seeing. And so the compromise is really far outweighing from a benefit standpoint than the risk that's associated with that. Another question that came in from Andrea is a big question we face is when a non-frontline healthcare worker should consider themselves exposed. If both the healthcare worker and the patient were wearing masks, staying distance, no close contact for more than 15 minutes in hand washing, and the patient contacts the healthcare worker to say that they've tested positive, should the healthcare worker consider themselves exposed? So really no. If they're that far away and the risk is so small because you've got universal source control with good masking, you're 15 feet away, so the risk of the aerosols, even if they were present, is much lower, and you were not there for the longer duration of time. Now, one thing that they did change that many of you may have heard about or may not have is it used to just be a 15-minute exposure. Now it's a 15-minute exposure over a 24-hour time period. So that sounds a little bit ridiculous because, if you're like me, you can't even remember what time it is yesterday and what you did yesterday. So to keep up with 15-minute exposures, a little bit unrealistic. But what you described, Andrea, is doing exactly what you should do. So I would not consider that an exposure at this point because you're doing everything that's needed. The key is PPE. Now, one thing I will say is if you're going to be around someone who, let's say you have a loved one that you do have to care for in your home while they're isolating and quarantining and they are COVID positive. This is a situation where you would want to wear a respirator if you can get your hands on one, as well as eye protection. Because these respiratory secretions, especially when people have symptoms, can get in contact with our eyes, our mouth, and our nose. So my suggestion, which is readily available in places like Amazon, is a face shield. It's very, very easy to wear. You can disinfect it very easily, and it's a lot more comfortable. If you go out to I've seen people go to Ace Hardwares and Walmart and they get the safety goggles, you can't see. They fog up very easily. So a good face shield is something that is completely appropriate when you're having to care for a loved one as well. So another question that came in is, are you saying that if you have no symptoms, you are less of a potential carrier than someone with lots of symptoms? I always thought that people without symptoms can be silent carriers. So absolutely. So as I mentioned earlier, the most current data that came out last week from CDC said that 50% of people that have COVID are asymptomatic, meaning they have no outwardly showing symptoms. So folks that you're interacting with on a routine basis could look fine, feel fine, and not have any symptoms, but they could absolutely be shedding the virus. There's also this concept called super shedders. And a super shedder is essentially someone with a very high viral load. We also see this with things like HIV, for example, where they have a higher possibility of transmitting infection to another person. With respiratory viruses, though, the risk is substantial because if that aerosol or that respiratory secretion is out there, it's carrying a much higher viral load than is needed to cause infection. So that's really where we sort of are concerned about that. And that's why good universal source control is helpful. Because a lot of people have asked, and I see one of you mention, should I wear eye protection when I go to the grocery store? No, there's really no reason to do that. That's not a current CDC recommendation, especially if you're staying away from other people, because keep in mind that social distancing and sort of staying away from other people is really the best deterrent. If you have to be close to someone, then that's really where PPE or personal protective equipment can become helpful. But I know for myself, when I go in the grocery store, I pick a certain time that I know that no one's going to be there, and I zip in and I zip out. I've also found that they've started curbside delivery, so I can actually order my product online and I can just have them put it in the back of my truck. So there's lots of ways that you can do that. So that's just something to think about. Another question is, do you disinfect visors between resident care and how? So good question. So if you're wearing a face shield, most face shields will recommend that you disinfect the outside of the face shield and not the inside. They recommend that you just use a regular wet paper towel on the inside. And the reason for that is most of those face shields on the inside have an anti-fog coating. So if you disinfect it, you're going to remove that coating with a few applications of the disinfectant. But the outside is the area where you're going to have that potential risk. So then you would want to make sure you disinfect that on the outside. And with any disinfectant, there's a concept called contact time. So on the back of the product, it should tell you how long that product should remain wet in order to disinfect all of the viruses and bacteria that are present there. That's usually a few minutes. So all that means is disinfect it and let it sit there. Don't put it back on your face or anything like that until you do that. Next question came in from Andrea. Should pregnant women have any reason to be concerned about the COVID vaccine since they were not part of any of the clinical trials and we don't know how it will affect fetal tissue? So that's a good question. The phase 3 clinical trials that are being done have not included every single population that's out there. Which of course is normal for vaccines. For example, if you look at what we prescribe to children, almost 80% of medicines that are prescribed to children are technically considered off-label, meaning that there was no clinical study done for a pediatric patient, and for obvious reasons. I mean, I'm not a parent, I'm a parent to a dog who is my world, and I would never consent him for a clinical trial. If you're a parent, you would never give your child to a clinical trial unless it was for their own benefit, right? If it was an oncology treatment or something like that. So, generally speaking, vaccines are usually safe for pregnant women, depending upon what the vaccine is. I have not seen the final labeling that FDA is going to approve for these vaccines. That will probably be coming out this week. But the labeling will guide that decision as well as a conversation with your obstetrician. And so, I'm a big proponent of take the guidance, take the labeling, and have a conversation with your healthcare provider. There may be instances where you may not fit in that box, but we may know that and you may not think about it. And so, this is a situation where when you're talking about something as personal as a vaccine, it's best to talk to your primary healthcare provider that has that relationship with you, that knows your whole history, right? Not go to an urgent care where you have doubts and they don't know anything other than that sort of isolated visit. Because, when you come in to see us at the emergency department, we're looking for that one acute problem you have. We're not there to diagnose the fact that you have a blister on your toe when you came in for a headache. And so it's a very different animal. So, normally speaking, this will be safe. This is also a different type of vaccine. So this is a messenger RNA vaccine that uses sort of a conduit to get into the body, but it doesn't alter your DNA. So this is extremely powerful as a manufacturing tool. And frankly, I think it gives us a lot of hope for things that we can see in the future, because we can't wait years for vaccines for pandemics. And I will say, regardless of what the news media says, I am very optimistic about how many different people, organizations, private partnerships, CDC, federal agencies, as well as, companies like Pfizer that have come together to say, let's help stop this global pandemic. Especially competitors. It's pretty unheard of to see pharmaceutical competitors sitting at the same table trying to solve a problem together. So, from something that was very difficult comes something that's really good. So hopefully that answers your question, Andrea. And a couple other things that I'll just sort of summarize on and see if there's other questions is, there's also this sort of concept out there about avoiding unnecessary travel. And, I generally agree with that. If you don't have to, don't go. But for example, if you can go to Florida and you have a beach house, just making this up, I wish I had a beach house. I'm sort of trying to throw that out there in the atmosphere that maybe I'll get one day. But if I'm going by myself or with, my immediate family and I'm going to stay in the beach house, that's perfectly safe. So it's not to say that you can't go somewhere as long as you can maintain sort of our normal infection control recommendations. So going and sitting on a beach outside in the sun is completely safe. Going to a crowded grocery store is probably not the best thing to do. Going and sitting in a crowded restaurant, not the best thing to do, but sitting outside, completely safe to do. So it's really, again, all about exercising that good common sense approach. And there's also been one other thing that's been mentioned here this week. CDC just updated this in the past 5 days, is the recommendation about wearing masks if you're in your own home and you have visitors, or if you go to another person's home. And I frankly have a little bit mixed emotions about this. And I'll tell you why. It makes total sense from a public health standpoint, but I think that we have generally low compliance in general with what we're asking people to do, and folks are tired. And so what I would be more of a fan of doing is saying, let's spread everybody out. So that we don't all have to wear a mask, the entire time we're visiting together. Or let's go sit outside and let's have lunch outside at a huge table. Or let's spread out in the backyard or whatever it may be. Or let's go to a park and enjoy some fellowship together. So there are ways to do that without having to isolate everybody and also wear a mask all the time. When I go home this Christmas, I will be wearing a mask only because I'm a high-risk individual that's been exposed so many times. I will also be tested 3 days before I go, and I'm going to test my family. So I'm pretty fortunate that I have access to rapid testing and a portable machine, but that's the abnormal, right? That's not something that's normal. And it's really out of an abundance of caution to make myself feel good that I'm not going to expose my family. And also my dad is not the most religious about masks. He wears it around me, but he does not wear it all the time. And so it's also about knowing what the behaviors are of your family members and sort of taking that into consideration as well. It looks like Teresa had a question about what are my thoughts on travel on airplanes? I feel very safe on an airplane. I have flown, I will fly. I'm flying again in January. I am a big Delta guy, obviously, since I live in Atlanta. And I can speak, I was part of a panel that they commissioned of experts to talk about coronavirus. And each of the airlines has hired huge medical organizations like Mayo Clinic, Cleveland Clinic, to help them here in Atlanta. Delta uses Emory, which is one of the world's leading centers for infectious diseases. And each of them is doing a phenomenal job. And frankly, I think going above and beyond. Delta, for example, announced that they're going to keep those middle seats blocked through the end of March. Many other airlines have done things that are similar. Everybody's required to wear a mask. They're using widespread disinfection after every single flight. Never has that been done before. They are screening airline employees randomly. Delta, for example, does a random screening every single day. They test 25% of people coming to work. They will test anyone who is symptomatic before they send them home to help them isolate so that they know what to tell their families. So I really have no qualms at all flying. As a matter of fact, I think flying is a lot safer than a lot of other activities. So I would have no issues with that. Now, that being said, that's for domestic. If you're going international, you're going to see more and more country restrictions about what you can do as far as coming into a country. I know, for example, Delta is operating a flight overseas where they're doing testing 3 times before you board the aircraft, and then they're doing testing before you come back. So that may become sort of the temporary normal for certain geographies. But again, I would not personally be getting on a plane going to Italy or some other place right now. That's just me. I'd like this to sort of die down a little bit more. But if you can go for a nice beach vacation and you can limit your exposure, then I think that's perfectly fine to do, and it's healthy to do that. So again, exercise good common sense. Looks like Safira had a question about what about overnight in a hotel or an Airbnb? If you are going to a corporate national chain, Marriott, Best Western, Hilton, they all have extremely thorough programs to deal with this. So I would have no concerns with that whatsoever. One of the things that you can do, and I actually do this every time I travel, is I carry Ziploc bags in my bag. TSA probably thinks I'm a drug dealer with all the Ziploc bags I have. But the reason I do that is I put like the TV remote and I drop it in a Ziploc bag, and that's what I use so that I don't have to worry about contamination. And so there's little things that we can do that allow us sort of that, again, common sense approach. Another thing that hotels are doing is they're not doing room service. They're not opening the restaurants mostly. So if they do room service, they drop it outside of your door and they leave it. There's no contact. And there's a lot of different ways that you can do that, but you would be very safe in a hotel. They have all installed new filters in their HVAC systems. They're cleaning those rooms thoroughly. Housekeeping is not coming in when you're staying there unless you request it. And if they do, they come in full PPE. You know, and a lot of the hotels are also screening their personnel. I went to a hotel a few weeks ago for a class with FEMA, and maybe it was because I was there for a class with FEMA, but they actually screened me before I got in the front door. They were asking me questions. They had a poster that said, have you had any of these symptoms? They tested me for a fever. And then I totally freaked them out when they said, have you had contact in the last 14 days with coronavirus patients? And I said, yes, hundreds. And the lady said, well, we need you to stay here. We need to go check with the manager, right? And so it was really, you know, something that you have to think about. How is their exposure risk being mitigated? But most hotels are fine. Airbnb would be a little bit more risky, in my opinion, simply because there's no standardized approach and that's someone's personal property. So I would have more reservation about that personally. Now, if you're going to like a chain where they rent out, for example, beach houses, and it's a corporate chain, they're all doing these practices, but I would be more worried about sort of those one-offs as well. And then looks like two more questions. How often should you change your gown when doing COVID testing at a facility? So if you're doing COVID testing alone, you do not have to change your gown between patients. That is completely abnormal to what we would normally tell you when dealing with patients. So if we're going into a patient's room and then coming out and going to another patient's room, we would be changing the gown. But for purposes of COVID testing, you can leave that gown on for your entire shift if you're doing testing. Of course, that would change if you became contaminated. So somebody coughed, sneezed, or something like that, you got respiratory secretions, or if the gown became torn or no longer intact, then we would advise for you to change it. But other than that, you don't need to do that. It looks like the last question is UofL Health says you have zero exposure if you're wearing a mask and eye protection. I would agree with that. And I think I said that earlier. I don't ever use the word zero. That's just my own thing. I think zero is a dangerous word to use legally and medically. I think Dr. Furman's laughing, so she agrees. You know, we never say that the risk is zero. We say the risk is very, very low. You know, and so what our goal is to give you tools and tricks to minimize the risk as much as possible. So, you know, your risk of contracting coronavirus when you're properly using PPE and you're staying safe is very, very low. Obviously, I'm a living testament to that because I've treated thousands of these people and I've not gotten it, thank God. But I'm very, very religious about my practices. I don't wear my clothing in my home when I come home from the hospital. I have, you know, very specific practices that I follow. I don't wear any scrubs home. I take all of that off at the hospital. I have hospital shoes. So, you know, you can consider that if you are in a high risk environment where you might want to take those steps as well. So I think I have 2 minutes left.
Thank you, Dr. Garrett. This was amazing. Thank you so much for spending some time with us and sharing your thoughts with us. I'll just make one comment about Airbnb. I'm an Airbnb host, and you have to sign off on certain guidelines that you have to adhere to in terms of cleaning. Otherwise, you cannot host anymore. So, I mean, they at least as a company are trying to make it a little bit more safe. Well, I just want to thank everyone for this great session and invite you to join us on January 5th for our guest speaker is going to be Carrie Butler from TARC, and she's going to talk about public transportation and COVID-19. We will not have a session in 2 weeks as that's the week of the University of Louisville's break. So thanks everyone for being on the call. Thank you, Dr. Garrett, for spending such amazing time with us. We really appreciate it.
My pleasure.
Thank you. And
thank you. Happy holidays.
Have a great holiday, everyone.